morning and welcome to our latest Posturite webinar about reducing risk for your business with the most accurate COVID lateral flow test. So I'd like to welcome today Jack Armstrong, Louis Davis and Freddie Maduka. I have to say, COVID has obviously taken all of us a bit by storm, and sort of coming out of it and learning how we can protect ourselves has been very important. And from personal experience, we actually set up a COVID testing station at Posturite, so I have some very personal views on lateral flow testing. I was also, with my ergonomics hat on, looking at usability of ergonomic tests, and have found by the research that the usability really affects the accuracy of the tests. And so that's something I think we really need to look at going forward. So I'm going to be really interested in this topic today. Can I just say to you that we are going to be making all these slides available, and in fact we are actually having a paper being also published at the same time, so please don't feel you need to take notes during this. I hope that there's going to be some good detailed information that perhaps best just to listen to, and then you'll have all the information you need to recap on it afterwards. So please be reassured by that and listen. So I think probably without further ado, I'm going to let the guys introduce themselves. And so I think sort of starting off with Jack, can I hand over to you and tell us about yourselves and all about the COVID-19 lateral flow test?
Yes, thank you, Catherine. Thank you for the introduction. Thank you, everybody, for joining. So my name is Jack Armstrong. I'm a partner and operations director at UK Wholesales. We have been providing B2B sort of solutions and wholesale items for 30 years. To a variety of sectors, really ranging from healthcare, hospitality, and hospitals and corporates. And so what we've done is we've teamed up with Hughes Healthcare to provide what we believe is the most accurate lateral flow test in the market today. And yeah, we'll do a short presentation really and take any questions you may have and go from there. I'll just introduce Freddie as well.
Yeah, so my name is Freddie. I work for Hughes Healthcare in technical validation and product assessment. I've helped with both the IPs of the test, usability. Making a test easy to use has been one of the most important things we've been trying to do, and then bringing the test to the UK market, both for private and public sectors, supporting the NHS and the UK government.
Great, and we've also got Lewis here from VHealth. Lewis, if you just give us a quick intro on yourself.
Yep, so hi, Lewis James Davis, CEO of VST Enterprises and VHealth. So I've designed VCode, the V Passport, and the VHealth Passport that we'll go through today.
I can't wait for
it to be. Thank you. I just show a short video on UK Wholesales, and this is one of our adverts.
My friends can come and play.
Today. Oh, I'm slipping away, so don't let me go now. I'm all up in that love.
That's your friend there, go for it.
Where do we go now? You just have to put the swab in your lower nostril. You're welcome.
And can men come over?
Yeah. We'll do the COVID test first, okay?
Yeah, so like I was saying, we've teamed up with Hughes to offer the lateral flow test, and really we found that we were looking after a lot of clients and we're struggling to find a very good test. So we'll go into a little bit of detail on the test itself and go from there really. So what we want to think about today is the risk that COVID has in the workplace. A few questions to think about really are, what are the consequences of an outbreak in the workplace, and what can you guys do as corporates and business owners and people within a business environment to limit that risk. And what we believe we have here is a solution to implement a very good strategy to ensure that you have the best tests moving forward. So this is a short instruction video just to show you a little bit about the test itself and how it's administered. And what I'll do now is hand over to Freddie, who will give a little bit of an insight as to the ins and outs of the test itself and where it kind of sits in the market and the unique advantages it has over other tests in the market.
Thanks for that, Jack. Yeah, so in terms of the test itself, there are certain differentials when comparing lateral flow tests that may not be apparent to someone not familiar with all the different brands, the different makes, the different styles of lateral flow tests. I think now, as we're moving forward, the biggest differentiator, which perhaps isn't being talked about enough, is the ability to detect the new mutations and the new variants for COVID, which are sort of proving to be difficult, especially as we're looking to get people back into the office, back into work. And people have been vaccinated, but perhaps not against new variants like the Brazilian or the double mutant in India. And our test detects what's known as the nuclear capsid protein, which is for the whole of SARS-CoV-2 and any mutations that may be presented within, not just currently circulating, but in the future as well, which is a huge advantage to know that any new strains that do develop in the future, this test will be able to detect with the exact same accuracy as it detects the original strain. And that has been validated independently at Public Health England's Porton Down. And you can see actually not many other tests in the market have been built to detect the nuclear capsid protein. One or two of the government approved tests have, but then they come with other difficulties that are either more difficult to use or a 5-step or a 4-step process rather than a 3-step process, which our test is, and then with a very invasive, uncomfortable swab, which is a nasopharyngeal swab, rather than our test, which is a very easy nostril swab with higher accuracy, even at the less invasive swab mechanism. The other thing to talk about, obviously, is accuracy and how different accuracy markers are present with the sensitivity, which is really the key statistic for accuracy. With sensitivity, you want to get the people who are declared as negative by a test, but are actually positive. Those are the dangerous ones, because then you can be allowed into the workplace thinking you're negative when actually you're positive and infecting other employees. As you can see in this chart, our sensitivity is completely industry leading. These are all independent studies, especially the one in San Diego in the United States, carried out by the Azure Institute, showed that on the nostril swab, we have a 97.05% accuracy at detecting those true positives, so to speak, and an overall accuracy of 98.6%. As you can see with the other real life studies, like down below with the ANOVA Biotime test, which is one the government went with earlier on, and the Abbott test, which is a well-known American test, it can vary massively when dependent on what is known as viral load. So how infectious someone is and whether they're asymptomatic or present with symptoms, or where they are in the infectious cycle. Our test has the highest accuracy across all viral loads of any lateral flow test in the market, and we achieved 100% accuracy at Public Health England Porton Down's independent review of our test in their phase 2 validation, which again just shows the true accuracy of our test. And when you combine that with the ease of use, the fact that the tube's already pre-filled and sealed with liquid, and it's just a nostril swab, rather than the oropharyngeal swab that is required by the government test, which also needs the person who takes the oropharyngeal swab can't eat or drink anything in the hour before the sample is taken, which is quite inconvenient really, and then can throw up false positives when done in that way, whilst our test is just a pure nostril swab and has a higher accuracy at that compared to the other tests with the more invasive swabs. Yeah, and then this is the clinical report that we have from San Diego. It shows a total of 605 samples being taken, 170 of those being positive, and 165 of them being correctly identified, with a -5 being an extremely low viral load to the point where infectivity is at an incredibly low level.
So in terms of next steps, what I think is worth thinking about here is what can everybody do to ensure that your business is prepared. So as Freddie might touch upon a little bit later, is that the UK government will be reducing their subsidies in terms of lateral flow tests in the coming weeks and months, and this will see private market kind of take over really in terms of supplying lateral flow tests. So there will be a need for companies to ensure employees are tested more regularly, and it's not so much about getting the best test is one thing, which we found for our clients. Great, we've got a very good test, the sensitivity is great, it picks up on the different variants, it's easy to use, and the supply is very good as well. But it's a completely different scenario when you're looking at the traceability feature. So at UK Wholesales, we've got a lot of corporate clients, with thousands and thousands of staff, and we were sending out tests, and quite rightly they were saying, well, how do I know who's had what, and how can I manage that from an admin perspective? So we're very lucky to link up with Lewis from VHealth, who has we believe we've teamed the best technology with the best test. So I'll just hand over to Lewis now, who'll be able to give us a bit of an overview as to the technology itself and how it can benefit you guys as companies.
Thanks, Jack. So hi, Lewis James again here. So I started VST Enterprises in 2012, which is the main founder of the VCode, which you can see on the images here. This is the 2D barcode. So I launched it at CES in Las Vegas in 2014. And then I was awarded the EU Seal of Excellence in 2015 for traceability in the supply chain, where basically you would give the provenance of any item down to a consumer level. So we built it end-to-end secure, so nobody can hack these codes from the front end, and it's all encrypted all the way down to the database. So the VCode itself is 2.2 quintillion variations of unique VCodes, all of which can be scanned at distance 2 to 3 meters away, which is perfect for this health passport. It can be scanned up to and over 100 meters in other circumstances. But the main benefit for health passes and other things is the VCode allows one code to be different things based on who is scanning it, where they're scanning it, what time and date they scan, and more importantly, who they're logged in as. So that would mean that one VCode for somebody who's at work on location could see something different from a health pass than if they were at home. So we've been working with governments since 2015. We've been working on ID projects, so end-to-end identity, where one VCode could be different things about the person. We've also got a contract with the United Nations funded SDG project, where they want to give 9 billion of these codes to everybody on the planet by 2030. So in the pandemic, we launched the VHealth platform, which all of this is made on. It is all ISO certified and GDPR certified. And we've been working with businesses where they needed the staff to be in close proximity to each other. It does have a built-in track and trace system called True Contact. It's basically where you scan somebody's VCode, it would mark you as together. And if one of them gets tested positive, it would notify the other one that they've had a true contact and to go and get retested. So with our experience on this, we've had a lot of good feedback from employers because they can see a dashboard of their staff that are getting tested and any outbreaks that they come in contact with. And also we're live in over 80 countries. So we've teamed up with Hughes Healthcare to put not only a VCode on the test, but also link it in with the health passport. So you would have a secure end-to-end journey from scanning that test to know that the unique code on the test is only used once, and it's paired with a unique passport as well. So you can see some of our users on there and some of the other tests. Network Rail is one of the things that we started with in King's Cross. So we had quite a lot of positive cases come in there, and they had a costly fine if they were delayed in delivering their project. And obviously we stopped outbreaks because of the true contact system and the constant testing. So everything is evolving. As Jack said, the free tests from the government aren't going to be around forever. And we are trying to support Hughes Healthcare in becoming the test of choice in the UK with the health passport.
Thanks, Lewis. So just to summarise, really, we strongly believe that we've got the best test in the market in terms of accuracy, sensitivity, and arguably most importantly, picking up the different variants of COVID, which seems to be the biggest challenge that everybody faces at the moment. Really, we've teamed that up with what we believe is the best technology as well through Lewis and vHealth. And what this enables us to do is limit the risk or minimize the risk for companies by providing an end-to-end safety solution, really. And by delivering this, we hope that it reduces the risk and it's easier to manage and try and get back to some form of normality within the workplace. We strongly believe in a British product, but it's made in the UK. And we're very, very well equipped to deal with the future. So if there's any other questions, really happy to answer, but like I said, we'll definitely get some points over to you sort of condensed so that you can share this with your colleagues at your companies.
Thank you very much, team. That was great. We have had a sort of few questions coming in, and actually I've got a few myself as well, so I'm going to be asking away those. Can I just ask, obviously this looks like a great test, and I expect it to be popular. How many can you supply? I mean, how much of this can you handle? Because there's a lot of people on the planet who want to be tested, I would imagine. What's that looking like?
Freddie?
Yeah, so we actually we're developing right now. We've already put in place a 300,000 square foot manufacturing plant in Northern Ireland with support from the government and direct investment to supply the UK market. We also have offshore manufacturing for the time being that could be scaled up to 300 million tests a month to supply the global market and global industries as well, including international governments. So we feel we're in a better place in terms of supplying capacity than any other lateral flow test manufacturer in the planet.
Okay, that's fantastic. Gosh, they're coming in thick and fast now. I've got a clarification from somebody just saying, do you need to swab the back of your throat, or is this just a nasal test?
No, it's a pure nasal test. You do not need any sort of invasive nasal cavity swab or an oropharyngeal swab on the tonsils. It's just 1 to 2 centimeters on the inside of each nostril, swelled 3 times, and then into the lysis solution, and then into the test cassette. It's an extremely simple 3-step process.
I've had, from a personal experience, I've had people who've had broken noses and things like that. So I presume since it's really quite low down, that's less of an issue than the government test at the moment. Is that correct?
Yeah, it's why in Austria, the Austrian government reviewed over 50 tests. This was the only test they chose to be approved to be self-tested by children in schools due to the ease of use, non-invasive nature, and the 3-step process, like I was saying. Okay.
Any indications on cost or how they're packaged? Do they come in sets of 10? Any advice on sort of the practicalities, I suppose, of providing the test? probably this one for you, Jack, isn't it?
Yeah. So they come in packs, single packs, packs of 5 or packs of 25. And prices range depending on volume, but you know, it can be anywhere from sort of £5 a test upwards, really. But it all really depends on the pack size, the volume, and obviously where it's going as well. But the capacity that we've got available on the ground in the UK is another real strong value add, really. We've got up to 1 million tests available for next day delivery. So having that, you know, ready to go, you know, it's a big pro for a lot of our clients and governments as well.
Do you ship internationally? Because I mean, obviously, we got lots of people who have got, you know, sites other places in the world. Are you able to supply there too?
Absolutely, yeah. So one thing which we're very busy at the moment internationally. So it seems that, you know, obviously everywhere's got their own challenges with outbreaks of COVID and the different variants. I know, you know, Freddie, we were discussing the other day about the Seychelles. Most people there, they've all had their first vaccine, and 60% have had the second vaccine, and now they're in lockdown, you know, because of a different variant. So we've recognized the challenges that they have internationally. But yeah, to answer your question, yes, we deliver up to 1 million tests anywhere in the world within 7 days.
That's fantastic. I've got a question here about how often would they recommend you take the test? You know, sort of twice a week, as sort of is being recommended at the moment. Is that the same sort of figure for your test?
Yeah, I would recommend it. It depends on the type of workplace. I think food packaging plants and manufacturing plants perhaps could be doing 3 or 4 times a week or every day, because of the highly sort of the careful nature you need to be about protecting against an outbreak. And then other office type spaces, I would go with the government guidelines of twice a week.
Yeah, I mean, I suppose it's like all these things, it's all risk based, isn't it? And, you know, anywhere where you have to have close contact, you're going to be more at risk, and therefore you need to test more. Freddie, whilst I've got you, we talked about how the test works, and you were talking about nuclear capsule proteins and nucleic acid detection. Can you just go over that again so we're quite clear what the difference is and why this test is more sensitive? Or perhaps you better use the words as to what it is, but it does appear to be showing up the likelihood of having COVID more than other tests. Can you just explain why that is and why it protects against the variants and still being able to pick those up?
Yeah, definitely. So with the, it's actually also related to the vaccine. So when your body receives the vaccine, you start producing antibodies, which hunt after what's known as the S spike protein on the virus, which is a specific shape. The reason why
those are the spiky bits. Sorry, they're the spiky bits. Okay.
Those are the bits that spike up. Yeah. And those spiky bits, so to speak, are locked on in a key and lock type process to the antibodies that the vaccine has started your body to produce. When you get a mutant or a double mutant or a problem with mutations, the spikes on the virus change quite dramatically. And that's why a lot of tests that go after with the lock and key type process in their test cassettes, the S spike protein, have huge difficulties with the accuracy of detecting these variants. Our test is what's known as the nuclear capsid protein detection system, which is actually a genetic code match of SARS-CoV-2, which is a much more holistic sort of the whole virus rather than just the S spike, which is why we have such a higher accuracy level and then also can detect the variants. And then just one other technical element of the test. Every other test on the market uses what's known as the colloidal gold test mechanism. It's quite common in the in vitro diagnostic space and in the rapid test cassette business as a whole. We actually use a gold nanoshell technology system under the test cassette, which really enhances the sensitivity at low viral loads. It just gives the test cassette a lot more of an ability to detect the virus when it's not so prevalent in the viral load.
I mean, that's quite interesting, because I have to say, when I looked at your test cassette and I looked at the other ones that I've got, they looked incredibly similar. And in fact, I thought, do you know what, is this the same? But they're obviously not the same. So even though they look the same, they're different.
There are lots of different quality factors in those cassettes. One of which is in order to flare up the line on the positive, you need to lace the test with certain detection markers. The quality and the manufacture quality of those detection markers is absolutely vital for the accuracy of the test, including what you lace under the paper, like I said, whether it's a colloidal gold and a poor raw material quality of the colloidal gold under that test cassette, or with our test, which is a gold nanoshell detection system, which is again the only one in the market, patented, unique, and which is why we have the highest accuracy of any test in the market.
Okay, I mean that's really, because as I say, I did look at it and think, well, actually the test may be different, but actually the cassette looks remarkably the same. Does the test pick up asymptomatic cases as come through?
Yes, it does. It does pick up asymptomatic cases. Any infectious individual, it's almost certainly going to be picked up. There are a few cases which PCR will pick up that rapid tests don't. However, as government reports have come out, that's often related to infectivity. So it's not just a random scattergun approach, especially with our test. We've looked up to the point where with viral load in that range, we've seen that it drops off at what's known as a CT rate of 33. That's when infectiousness really drops off. So there have been instances where someone has been tested positive on a PCR test, or one of the laboratory 48-hour tests, but they've been around everyone in their household. No one has had COVID before, and they haven't given it to anyone. And everyone said, well, how is that possible? But it's because the PCR is almost over officious in terms of if it detects any strain of the virus, no matter how small, it will flare up a positive. But that doesn't mean you're actually infectious all the time. The lateral flow test, especially ours, is incredibly accurate at detecting infectivity, whether you have or don't have symptoms. Even if you're pre-symptomatic, our test will still pick it up. There's actually an example of a company that was testing all 104 of its employees. They were using a different test, what's known as the HealGen test, and it didn't detect any positives on the Wednesday. Then as a comparator, they used our test on the Friday. It detected 7 asymptomatic positives, 5 of which then went on to develop symptoms and 2 of which remained asymptomatic, and all 7 were confirmed on the NHS laboratory tests. So it just shows how important it is to have a good test that will detect those asymptomatic individuals, because if not, they could have had a serious outbreak in the following week.
Yeah. I've just got a question here by somebody asking whether you're saying that the test is more accurate than the PCR.
No, the PCR test is the gold standard, so to speak. With a laboratory, it can detect every single strain of any sort of virus in your system, and then denote exactly which mutant or which virus it is. But what I'm saying is the PCR will detect any semblance of the virus, will throw up a positive, but that doesn't necessarily mean it's related to how infectious or likely you are to pass the virus on to other individuals.
Okay. Is this test faster than the other tests in giving results, and how fast is it?
Yeah, dramatically, actually. It's actually in 2 phases. Firstly, the taking of the test is much quicker than other tests. Obviously, it's much easier to use in only a 3-step rather than a 4 or 5-step process. And then in terms of the results, we've seen positives actually flare up even within 60 or 120 seconds. So they come up extremely quickly. And then essentially within 5 minutes, realistically, you're going to know whether you're positive or negative. Nothing really changes after that period of time. For the really faint positives, we say it's best just to be safe to wait 10 minutes, but that's a lot quicker than the 30-minute government ones.
This is a general question. Do you still need to take tests if you've been double jabbed?
Yes, you do. Unfortunately, virus is really good at preventing you from going to hospital with severe symptoms of COVID. But again, it's really struggling to detect the variants. We've seen in Chile, which has the 3rd highest vaccination rate of any country in the world, has got a real problem where ICUs are completely full. They're going into lockdown again. The Seychelles, where 100% of the population, like Jack was talking about, have been vaccinated, and 60% again with a 2nd jab, are now in lockdown with cases spiraling upwards. It's just the vaccine is good at stopping deaths, but it's not good at stopping cases. That's the problem. And with the more cases, the more chances are that there are going to be more variants, which is why the government really see testing being a strategy for 5 years, which is why they're putting so much money, over £1 billion, into UK manufacturing of lateral flow tests. It's really important that people test, even if they've been vaccinated, not just for themselves and their own safety, but also for passing the disease on to others, which they can easily do.
Yeah, brilliant. I suppose it's just I've got a question here. When will they be available in the shops for everybody to buy? Is that going forwards, or is this mainly for employers at the moment?
Yeah, so it's both.
That's probably a Jack one, isn't it?
I'll let, I'll let Freddie
well,
discuss
in
that.
terms of the regulatory side, we've applied since December for the notified body to VCode CE mark for home use, which will allow us to put it in Boots, Tesco's, all of the retail stores in the retail sector. And we're actually anticipating that to come through next week, but it's a bit of a sort of black box type process, you never know. But we've seen the draft certificate, so we know we've met all of their standards and it is ready to be approved for home use. And then it will be available in retail and then for employee testing. I think the advantage of employee testing is, as well with what Lewis was talking about with the V Health passport, getting that inclusive workplace safety solution rather than people sort of picking up their own tests, which is obviously great for other reasons.
Yeah, that's great. I've just got, I suppose, a cheeky one. Say, are there any samples so people can actually see how much easier it's to take? Jack, I'll reach out to you on that one.
Absolutely, of course. You know, we're happy to send out samples. You know, we strongly believe that once people see the test and see how easy it is to use, you know, they'll be very happy.
Yeah. Gosh, I mean, there's so much. I mean, I've got one actually about the passports type of things. Has there been any interest as far as travel passports? Because I'm looking forward to traveling again, and I wondered whether, you know, there's any link or any possibility of using the system to record tests and for travel, that sort of thing. So, Louis, that's probably over to you for that one.
Yeah, so our health certificates that you can print off from the portal are actually accepted in every country. So if you have a valid PCR test, you can use that certificate. Antigen tests are accepted by a few companies, but you should always look at the travel conditions and the advice given by the different airlines. So antigen I know is accepted in France, and it might be accepted throughout Europe on continent. But we have been working with other airlines and other airports as well. So we've got a meeting actually today to finalise a lot of the African airports to accept people to come in solely on this passport. In the US, we do have the passport of choice, which has been given by the state of Nevada. And we're also working with Collinson Group as well to put that into all the airports as well.
So very much watch this space, you know, and looks like as we know more and as we get that reliability, that things will open up even more, won't they?
Yeah.
And we are actually, Louis mentioned Collinson's, we are also the exclusive test of all the UK airports, including London Heathrow, and used exclusively at the airport testing centres.
Okay. Well, that's brilliant. I think we've covered most of the questions. What I will do is I will forward the questions over to you guys, and in case there's ones I've missed, because occasionally I do. I just really want to thank you, because I think that's been, I mean, certainly I've had my opportunity to ask lots of questions I wanted to know, but I think it certainly clears things up for me. And I also think, you know, as you're saying, as you know, perhaps free tests is going to get less from the government. You know, we're going to have a choice as to whether we buy, you know, where we put our money, and why wouldn't we put our money in the most accurate test? And I suppose that's the importance of actually knowing the data behind all of this. And, you know, with my ergonomics hat on, as I said earlier, I think the usability and making sure that, you know, people use them effectively, and the easiest way to do that is to make using it easy, and you certainly seem to have done that. So I think it's quite exciting and a necessary requirement moving forwards, as you've said with the some of the examples you've given. You know, things are looking a lot better for here, but we're going to have to keep our eye on the ball, and we need to make sure we can, you know, keep ahead of this virus. So may I thank you for that today. And may I just say to everybody, you know, that all the resources, a copy of this webinar will be available on the website, and also all the resources as well. And I know that the guys will be happy for you to reach out if you've got any questions. So please let us know. And hopefully this will help us all move forwards, have a good summer, and continue to open up our lives again. So enjoy the sunshine if you're lucky like me to have it, and enjoy your weekend. And I'll see you all soon.
Thank you.
Thank you.
Thank you. Goodbye.